Women's Work in Globalizing India. That's just one of those 19 titles she has produced. Of course, she's an economist and a feminist who does not require such a long preface in front of an audience like this, but here goes still. Presenting to you Professor Jayati Ghosh.
Thank you so much. It is such a pleasure to be with you, even if only virtually. How I wish I could actually be with you there in Kerala. It's always a pleasure to be with you in physically or virtually. Why? Not just because I have so many friends and comrades in Kerala, but because there's always a sense of excitement, of positive thinking, of looking forward, of thinking of how to change things. And I realized that every time I have been involved in any event or activity, any discussion in Kerala, some of those things have actually then been sought to be put in practice. People are not just enthused about what they do, but they actually do implement many things. It's a very, very different feeling from so many other conferences, so many other events, so many other places that people get together to talk about these things. So I really do feel very, very privileged. Thank you for inviting me to this. But of course, we also know that this is really a bad time to be a woman in India. The pandemic has been terrible for women across the world. It's not all women, of course, but the majority of women have been impacted in all kinds of adverse ways. The employment participation has gone down for two reasons. First, women have been disproportionately thrown out of employment. They are much more likely to lose their jobs. This is particularly marked in India. And they have been also forced often to leave the labor force because they're doing much more unpaid work at home because of various pandemic type restrictions, because of children being at home all day, not being able to go to school, because of the denial of other social services and care services in particular. In India, we know that already the women's workforce participation rate was unbelievably low and had been falling. And it got worse during the pandemic. The little data that we have has shown us that it is actually significantly deteriorated. And in addition to that, we've had all kinds of other adverse reactions for women. We've had domestic violence increasing during the lockdown and after the lockdown as well. Significant increase in hunger across the country, which is disproportionately felt by women and girls within families because of the failure of the central government to release adequate food grain stocks to feed the people, even when the godowns are bursting, even when we have an excess, significant excess of food grain stocks with the Food Corporation of India. We have a decline in assisted birth. This was very marked during the pandemic. During the lockdown, there was a 40% decline in institutional deliveries. Since then, we know that this problem has continued because of various difficulties that have been faced by women and the greater expense, the cut down in Janani Suraksha Yojana and other things that were actually designed to help women have the institutional deliveries. And there has been, as I mentioned earlier, a very significant increase in unpaid work. And of course, the entire system, the health system, which operates on the significantly underpaid work of women frontline workers, Anganwadi workers, Anganwadi helpers, Ashas, and a vast range of other scheme workers. They have been brutally exposed during this pandemic because not only have they had to continue working and expose themselves to health hazards and so on, but they have in turn been denied adequate protection, adequate facilities, sometimes even the social security that was promised them, they haven't received. In several states of the country, they haven't even been paid for several months now because state governments have been running out of money as the center has not provided the required resources. So as I said, in India, it's not a good time to be a woman. And obviously, these circumstances won't just change on their own. They have to be countered by proactive government action. And there are many things that can be done. There are many things that the government knows it can do, that everybody has been telling the central government to do, which have not been done. As I say, why it is so wonderful to be in Kerala and to be able to talk about these issues is because many of the things which I am going to mention are things which are already being done, have been tried to be implemented over the last few years, or in the pipeline, or being talked about. In other words, I do believe that, we are in a state where you have the very good fortune of having wonderful women leaders, but you also have, I think, an increasingly more sensitive, let me put it that way, increasingly more sensitive leadership, which is trying to do some of these things which I have just mentioned. Now, what does that mean? It means that unlike the rest of India, which has seen dramatic declines in women's workforce participation, in Kerala you actually saw an increase from, I think it was 16.4% in 2017 to about 20.4% in 2018-19, which is unlike the rest of the country. This, it's a very low rate. This is nothing to celebrate. Let us remember this. It is a shockingly low rate. But Kerala's women's workforce participation rate was always lower than the rest of the country. And the rest of the country has fallen so low that it is now below Kerala. And it has continued to fall. And even during the pandemic period, the data we have from CMI tells us it has continued to fall. However, in Kerala, it has not. It has increased, and it continued to increase even in the pandemic months. I think this is largely due to proactive government policy. Definitely, there was an attempt to maintain the employment guarantee in the rural areas, and there was the institution of the INCAL, the urban employment guarantee, which is still limited, but nonetheless is providing some source of employment, which is why we see a significant increase in casual labor. And we also see an increase in self-employment. It's the self-employment part. I think a lot of your discussions over the next few days are really going to focus on that, what you are calling micro-entrepreneurship of women. So I will come back to that issue. But we have to remember that 20% is not significant. And it is still a massive waste of a huge human capability in the state, which is highly educated. The most educated women in the country, Kerala has the highest ratio. And so therefore a lot more needs to be done. And I know that this is a government that wants to do it and is willing to think of new ways to do it and to push everything that has worked so far. I would just like to, I think, appreciate the efforts of the left front government this time and also in the previous, when it was here before, because I think this was recognized. The problem of the low women's workforce participation was recognized from the beginning, and there was a focus on enabling conditions. I remember when the earlier left front government was putting a lot of emphasis on in its budgets on public toilets, to the point where I think there were people even calling it, a toilet budget, because so much money was going into toilets. But this awareness that it is the extension of basic facilities, of amenities, of things that will allow women to go out into public spaces and be in public areas without worrying about things like that is absolutely essential. And that has been one of the enabling conditions, the making sure you have street lights, making sure you have public toilets available everywhere. It turns out that was a massive boom also during the pandemic, that it made a difference. So there was significant increase, I believe, in that, which one of the fruits of that is this increase that we've seen. At least the direction of change is a positive change, and I think that's greatly to be welcomed. And of course, more to be done there. But also there has been a recognition that you need to increase public employment directly. Kerala is one of the few states that brought in an urban employment guarantee. As I said, still very small. And it is considering introducing skilled activities and training into both urban and rural. I think that is very, very important. Because in a state like Kerala, you cannot simply rely on what is being used everywhere else for employment guarantee, earthwork and very basic and arduous work. We need to think of the employment guarantee as delivering anything that can improve the quality of life of people which includes a wide range of care activities, which includes a whole range of activities for urban regeneration, for greening the economy, for greening productive facilities. And many of those are not necessarily extremely arduous physical work. They can imply or require some degree of skill. And I think Kerala is perfectly placed to actually expand that kind of public work in a way that will not just provide employment for women, but will also have significant multiplier effects throughout the economy and ease supply constraints in particular areas. I believe there's also a possibility of moving towards doing things like that in the digital economy, but I'll come back to that. There's another critical area, and this of course everybody talks about it. The minute you talk about micro-entrepreneurship and so on, they talk about access to credit and the significance of making sure that women, self-employed, women who are running small enterprises get access to credit. Forget on equal terms with men, which they don't at the moment. It's much harder for them, of course, we know that. But if we could provide our small enterprises and micro enterprises access to credit on the same terms that the large corporates receive, then in fact, which should be the order of the day, but it's not, then in fact we would say yes, we're approaching something where these enterprises can be viable. At the moment, that is still not the case. And we also know that micro entrepreneurs need much more. They need input assistance, marketing assistance, often design assistance and all kinds of things like that. This is very difficult for individuals to do, which is why a micro enterprise model which is devoted to just leaving everybody out there on their own very rarely works, and really hasn't worked in the rest of the country for decades now. And therefore, the cooperative model, which is one that has been expressed in Kerala very well through the Kutumbashri, I believe that's the way forward. I think that's the way to go. A significant extension of not just only the Kutumbashri, you could think of a range of other cooperatives, maybe specific cooperatives designed for very specific activities rather than putting everything under the Kutumbashri umbrella. But a focus on the cooperative model which allows for economies of scale and allows for cooperation among producers, which has already delivered, I believe, some very excellent results, and there is massive scope for developing that further. I think this can actually be a way in which Kerala shows that vision to the rest of the world and the rest of the country. Because elsewhere, where you've had self-help groups being federated, the focus has not really been so much on a cooperative model. It's been more on a top-down kind of federation, which doesn't have the same beneficial effect. These are enabling conditions, shall we say. But there are other very significant enabling conditions which relate much more to the other work that women end up doing, and they do that in Kerala as well. The significant amounts of unpaid work being done by women within households, within neighborhoods and communities. So how do we deal with this unpaid work? There are the famous, with regard to care work in particular. Care, of course, considering care, it's of course direct care, which is looking after the young, the old, the sick, the disabled, and all of the other members of the household who are otherwise healthy, but nonetheless need to be cooked for, cleaned for, etc., etc., etc. That entire range of care work, the gender construction still in Kerala, like the rest of India, is very much the responsibility of women in the household. How do we change that? How do we reduce this big burden of unpaid work, which means that women who choose or are able to go out and search for employment have a double burden and therefore face time poverty, face a very significant decline in time availability, which doesn't just reduce their own leisure, it reduces the quality of the goods and services they can provide in unpaid fashion. If you're exhausted working all day, commuting, coming back, then to do all of these other activities, it's not just that it's exhausting for the person concerned, it also changes and reduces the quality of the work provided so that the entire household is poorer as a result. How do we change that? The standard answer now, it's in a sense the ILO has also taken it up, is to go for what is called the 4 R's. First of all, recognize it. Recognize that there is all this work being done and that it is work which contributes to society, to the economy. If you added all of that work, you would actually get significantly more women working than men. Quite the opposite of the general perception that there's a low workforce participation. Actually, women are working, they're just not recognized as such. Recognize that work. Reduce as much as possible the unpaid work. And reduce it in different ways. Bring in technologies where it's possible. Bring in public provision. That is, share the burden of that unpaid work with the state, with private sector where necessary and possible, within the household, redistribute. The third R, redistribute the work in different ways. And reward those who are doing care work as employment. Reward them properly. Do not give frontline health workers like Anganwadi and Ashas a fraction of the minimum wage, which is what happens in most of the states of the country. Do not throw them into a situation where they're not even called workers but are treated as volunteers who get an honorarium and do not get any of the other social security or other protections that are awarded to legal employees of the state. Treat them properly. Treat care work with respect, with recognition, and with proper rewards. That is better in Kerala, I would say, than in other parts of the country, but it's still not good enough. There is a lot to do still. We are still not in a situation where care work is, and unpaid care work are given the facilities, the amenities, the recognition that they require, and the rewards that they require. I don't mean that says, that means housewives have to be paid a wage by their husbands and so on. That is actually a paternalistic, patriarchal way of looking at it. We need to reduce the work and redistribute the work as much as possible. That's why I think schemes like the Smart Kitchen scheme are good ideas. And the idea of providing cooked food where people are not in a position to be, come home and cook and buy provision for the meals and so on. These are all very good ideas. And I think these really do need to be extended and developed much more. But there are other labor-saving devices that could be promoted. There are other ways of ensuring that the care burden is distributed in the society through public provision of a whole range of other care activities. Particularly, I'm thinking that it's important to expand community care. And there is an aspect of community care which is, it's not just creches for children, which of course is absolutely essential and crucial and so on, but it is geriatric care. It's care of the elderly, which is going to become a bigger and bigger problem. Kerala already has a very innovative scheme of palliative care, which I believe needs to be expanded significantly. We have seen how care workers are overburdened, even in Kerala. They're dealing with far too much relative to the number. They're very few in number. And this is one of those areas where an employment guarantee could assist care workers as well. You could actually have those employed in the employment guarantee being made available to assist care workers in different categories. So there's an entire range of activities that can still contribute hugely, not just to quality of life of women, but to quality of life overall, and increase the employment rate of women, because this would be proper employment. This would not be volunteers being paid a pittance. The Ayankali employment guarantee, I think, provides a huge potential in this area. So it's good that it's being expanded, but again, it's not enough. Of course, much better than elsewhere in the country, but in Kerala we expect more and we often get more. So as I mentioned, we include care work, include elements of training and skilled work, include greening and regeneration and environmentally necessary kinds of activities. Within the new sectors, the non-traditional sectors. I think there's a lot of potential again in Kerala for self-employed, often operating within cooperatives and sometimes in ways that are created by the ecosystem and by public investment in certain activities. One of the areas that I've often wondered why Kerala does not develop more is translation. It's an extremely literate society. It's a bilingual society, but it's not entirely bilingual. And translation is a very, very important area of access to knowledge. It's not just people being able to read in Malayalam things that are only available otherwise in English, but it's also the rest of the world getting to know what is coming out in Malayalam. Not just the literature and the art and the other creative things, but a whole range of other things which are very important for the rest of the world to know. There are, in Europe and in other developed countries, that you would have translation services for very, very small populations. For 500,000, there would be a specific translation service. Here you have a society that would hugely benefit from a dramatic expansion of translation services. And it's one of those things when once people realize that it's there, then the demand for it grows as well. People don't ask for something in Malayalam because they don't know it exists in the first place to ask for it. Think of a range of science journals or something, Economic and Political Weekly, the India Forum, writings that are coming out in certain languages. People who are reading only Malayalam don't know about it to demand it. Once it's made available, they will demand it. It will emerge as a flourishing activity in its own right, as it has across the world, wherever it has been done. But it needs that initial push from public investment. I need not mention that this is a highly employment-intensive activity. Machine translation doesn't cut it, cannot do the job. It's highly employment-intensive. It's a skilled employment, which is precisely the kind of thing that Kerala needs to generate. So I really think that there's a tremendous scope for pushing translation services. Then there is the whole codifying of traditional knowledge, still not adequately done, still not sufficiently recognizing the huge contributions made by traditional knowledge and making them accessible in a form that could be widely disseminated and accepted by scientific communities, which means codification, testing, and a range of other things that would actually bridge this so that it doesn't remain something that is viewed with suspicion because it hasn't been adequately scientifically tested. And those elements of it which do not pass muster would then not continue, but then we would nevertheless have very rich body of traditional knowledge widely available. Again, something that is skilled work, which would generate a lot more employment. Kerala already became, I think, a leader in health services. Of course, the proliferation of nurses from Kerala all over the country and the world, it's too well known to talk about. But this is something that really can be leveraged. And I think we all have to recognize that the sectors of the future, health is going to be very much part of that. The care services and especially health are going to dominate in employment-intensive activities of the future, not just in India, but across the world. And Kerala has already the experience that you can use to leverage that and actually generate not just skilling and training and so on, and not just exporting it, but actually generate better quality of care for different categories of care. I'm thinking of psychotherapy, therapeutic care, palliative care, geriatric care, which are still inadequately served in our country and which need much, much more investment. Finally, I would argue that, one of the things that the last year should have taught us is that our social policy is very vulnerable to shock. And so we really need to start thinking about stress testing our social policy. In finance now they're doing this big time. They stress test the banks to see if they can withstand the financial shock. But social policies are actually more important for the life and well-being of people. And we need to be stress testing our social policy. We need to make them much more resilient to shocks because we have to admit that we're going to face more and more shocks. The pandemic, we get through this, and yes, that will be great. But in the state of Kerala, you've already had to deal with the Nipah virus. You've had to deal with floods. God knows what you will have to deal with. It's important not just to make our economy resilient, but it's very important to make our social policies resilient to any kinds of shocks that we may face. And finally, just the last, I suppose, challenge I would like to highlight is that despite all of these measures, which are, of course, well-meaning and etc., we all know that patriarchy is very hard to get rid of. And it rears its ugly head in every possible way, not just in officialdom, but in societies, in panchayats, in families. It's a very difficult thing to get rid of. And therefore, the elimination, or shall we say even the reduction, let's not get too ambitious, the reduction of patriarchy requires more than just public spending. It requires massive mobilization with a sense of solidarity. It requires the kinds of things that you did with the Wall for Women, which was so inspiring, I think, across India and across the world. But it requires that sense of solidarity among women to be constantly reaffirmed, because otherwise it's a difficult battle often for women to fight on their own, whether they are women entrepreneurs or women workers or women who are doing unpaid work at home. And I think meetings like this are tremendous because they give you a sense of that solidarity. They give you a sense of the energy that can come when people get together to talk about the different ways in which women have and will continue to transform the world. And particularly, I have to say this, the women of Kerala will continue to transform the world and to inspire the rest of us. Thank you.
It's my pleasure to give the microphone to Shailaja Teacher to give you the concluding remarks about this keynote address.
Thank you, Jayati ji, giving an inspiring and informative speech to us. I personally saying I used to read your articles in Frontline and other publishing system, and I got many points. I got some answers, which some questions in my heart. I got answers from your articles because you are studying each and every aspects of the society and finding some points to action. And we got some answers from your articles. Thank you very much. Here also you mentioned very crucial points we have to address, especially in this ICGE International Conference, I think. You spoke more about Kerala, and you are asking Kerala what is your next plan, or what is your plan to overcome these difficulties. Actually saying this pandemic, this COVID-19, as we all know, the opportunities of women is being jeopardizing by the pandemic throughout the world. Women are pushed to the home, and all men and women are pushed to the home, and women are suffering more for the care work and other thing. It become a burden to women, and the little opportunity they got in the society is also diminishing, and it is a crucial problem actually. But in Kerala we are trying to solve this thing as much as we can. Actually saying this pandemic bring a thought that, or we can say a litmus test on system governance throughout the world, especially health system, we can say so. And what is your health system? You asked us to address our next policy about the health system, that giving more focus on quality of care and also this geriatric care, etc. And but the I think I am always mentioning the good system in Norway, Sweden and Denmark for the good health system. They were good, we can say so, and how they are giving interest in public sector, and they are investing more money in public system. But investment itself, or only investing more money will not save this kind of challenges. We cannot save people from the challenges. In Sweden, during the pandemic, they chose the method of mitigation. They have a very good public health system there, but it itself didn't save the people, you know. The Prime Minister of Sweden said that don't imitate our method. We have some failure in first part, but they are working hard. They will overcome definitely. They have a very good system there. But in the first part, they chose the mitigation method. But in Kerala, Kerala is a small state of a huge country, you know, economically not so fit as you said. And but we discussed it together, our eminent personalities in health sector and some experts. We started discussion when we know that a potential pandemic is spreading in Wuhan in China. That is in December last or January 1st of 2020 or December last of 2019. It started there. WHO reported that a potential pandemic is spreading in Wuhan. I think that is in January 18 that report came. At the same time, we gathered together, our experts and me sit together. Our chief minister gives some guidelines, etc. And we discussed how to manage this problem. The virus will definitely come to Kerala because there are so many students studying in medicine, that medical college in Wuhan. We are sure that they will definitely return back to Kerala and virus will come to Kerala with them. As we expected, it came, that virus. But when it came, we were ready to tackle it. We are ready to trace it. Our skilled persons in health sector, we were able to track that thing, and we had done a very good job on that. And with this pre-preparedness and our timely action, we can reduce the mortality rate. It is 0.4% in Kerala, you know. But the virus is that kind of thing that it will go to the society definitely. We cannot prevent it completely. That is spreading type, and it is now came to our spread to our society also. But now also we are fighting against the virus, and our ultimate aim is to reduce the mortality rate to save human life from this virus. And I'm not explaining that thing, but I am coming directly to the after effect of the COVID-19 in this society. And it's a difficult thing, you know. The existing society is not egalitarian. In India also, this feudalist culture, and there's a mixture of this feudalist and capitalist culture together. The consumer, one part, the consumerist society is bringing more danger things to society, especially to women. And the other part, that feudalist culture is here, the superstitions and that kind of things are also here. That also, women are also suffering from that thing also, the traditional things and the superstitions, etc. We have to fight with the two things, the fundamental things and also with the contemporary world, this kind of consumerist things, etc. And we have to find new methods to save the women from these dangers and to push them outside from these barriers, and we are doing some work. In the society, this government under the leadership of Sri Pinarayi Vijayan, we started 4 missions. That is unusual, that not only the plan work or the usual method, we started 4 missions especially. One is this to save the nature, or we can say that to promote the organic culture, etc., to save the nature, and that mission, I think that gives very much opportunity to women also. The eminent women are heading that mission, and they are doing so many things to clearing the ponds and wells, etc., to save the groundwater, or cultivating this organic cultivation. So many women are engaging in that. That way we are pushing them forward to get some opportunity outside the home, you know, not inside, only homely, that unpaid work. They are getting some payment for this new cultivation, etc., some group cultivation, some self-help groups, etc. That way we are pushing women outside. And one mission is called Life Mission, that is to give a home for homeless people. We are addressing a huge question, the whole world there is a challenge of urbanization. Urbanization is good in one part, but there are some challenges out of that, that is the slum formation, etc. If the agricultural sector is not flourishing, the people will lost everything in the village and they are directly going to the urban places seeking some jobs, etc. But it is unfortunate they are not getting there and they are dumping there and the slums are becoming. When I went to China once, they gave a topic to discuss that what is the solution for the urbanization and the slum formation. How to reduce the slum formation, that is the big question. In slums, women are suffering too much, without getting proper water or like facilities, etc. Because of some biological needs, women are suffering more than anything in slums. And we want to reduce this slum formation. Through this mission, that life mission, supplying a home for homeless, making some activities to building some flats for the poor persons to stay with, we are addressing that problem. Without forming slums, we are giving people shelters in cities and also in villages. We started that project and I think women are the very good beneficiaries of that project also. That way also we are addressing the work burden or the sufferings of women, to get rid of the sufferings of women. The other mission is on reform and in education sector, that also to make the education sector technologically fit and also academically most modern, that also we are doing. Another mission is on health sector called adhering, and we are changing this health sector totally. That is why I mentioned the experience of Sweden first, because Kerala cannot be compared with Sweden, because the population density is more in Kerala, and also the facilities that Sweden achieved, not only Sweden, the western countries achieved a lot on technological part, and Kerala it is not like that. We have a mixed village and urban areas, we can say it is urban, but it is not so flourished, the technology is not so flourished. But we are trying to get more technological support in our state, and we are doing some activities on that. And in this mission, this Ardhra mission, health mission, we are trying our best to change the basic structure of the health system. We had a very good public health system here. In each and every panchayat we have primary health centers, etc. But now we are changing the public health primary health centers to family health centers. There we are providing more women friendly activities there. That there are in PHCs there are some special space for women also. They can come and check their non-communicable diseases or lifestyle diseases, etc. And we are encouraging women to follow new lifestyles, to doing more exercise and how to come out and do some works, etc. And in health sector also people friendly and women friendly activities are coming. I am not explaining because the shortage of time, I am not explaining. But investing in public sector and to develop the public sector for the poor people, at least 50% of the population, they should have to come to the public health system and they should get affordable treatment there, affordable and quality treatment there. That is our aim, we are going on that. And also for the public investment in other sector also, not only the traditional method, we have to develop the skills. In social justice and women and children department and in other departments also, we are implementing some skill development programs for women, and we are forming some women groups for that. Here in Gender Park, we are starting a women's trade and research center, especially for women to promote the entrepreneurship of women and also some social business, etc. We are now discussing today about the social business, and without the profit-oriented business, other than profit-oriented business, we want to start some social things. How can include women in this? How can promote women other than the care work or other than the household work, unpaid work? We are giving opportunities to the women in rural and urban sector how to come forward, and we are drafting some policy on that, and after the policy we will definitely frame an action plan on it and we will go forward. My time is over. It is time to start the other session, but I will assure you, Jayati ji, that we will work on these things, that in health sector also how to promote the palliative thing. We have introduced a palliative policy, and we are trying to make a palliative care grid. There are so many NGO organizations other than government who are giving palliative works. We are joining them together and we are framing a palliative care grid, and that will be a great help to women who are nourishing or who are nursing these old age people in their home. They will support, and that way also we are lessening the burden of poor women inside the home, and they get some opportunity to come outside. And also the geriatric care also. I have to explain so many things, but there is no time, and we are working hard to get some answer for these crucial problems. Kerala is trying, but we have to work more, a long way to work, a long way to work. We want help from you and other eminent personalities like you. Jayati ji, I want to express my sincere thanks to you to pointing out some crucial issues, and definitely our government will address these problems, and after the conference here, I think I will get some light, or I will get some points for action. After that also, definitely we will do that. Thank you, Jayati ji. Thank you very much for
You
joining
are
us.
truly an inspiration. Truly, you are really an inspiration.
You know,
Thank you.